What are some of the most useful treatments that you've found for neuropathy?
Well, think about, we're in a health model, right? So think about what causes healthy tissue and nerves. The reason for neuropathy in cancer patients is excess oxidative stress. So that's how chemo works. It increases oxidative stress, it damages the DNA in the cell, and the cell dies. And cancer cells are more vulnerable to that than healthy cells. But any cell that has a fast rate of replication is going to suffer from side effects. So the neurons are fast dividing cells, the lining of the gut are fast dividing cells, the bone marrow are fast dividing cells. That's where you see these side effects. So to restore normal nerve function, so we have to have a healthy myelin sheath, so omega-3 fatty acids, vitamin D, and also we want to repair the nerves, so glutamine, and also acetyl L-carnitine is really good for repairing the nerves. And what's happened to these patients is they have incomplete redox cycling. And so what happens is they just can't quench the oxidative stress. And we know certain patients have SNPs where they're less efficient at that, or just the aggressiveness of the chemo might have overwhelmed the redox system. So I also just make sure there's plenty of antioxidants. Sometimes glutathione can really make a difference. If it's really bad, you can do IV glutathione, but oral glutathione also, or N-acetylcysteine, which is its precursor. You have to be careful with N-acetylcysteine because it interferes with drug metabolism.
Right.
And so you have to be careful with that. Acupuncture also is just fantastic. So I have a patient who came to me, maybe 6 or 8 years after successful breast cancer treatment, but her neuropathy persisted. And she was a smoker, so she had even more oxidative stress.
Mm.
It is paradoxical to keep smoking after you've had cancer, but there it is. It's irrational. That's the human condition. So we put her on this protocol of acupuncture 3 times a week for 8 weeks, omega-3 fatty acids, acetyl L-carnitine, and I just had her eat the rainbow to get more antioxidants. And her neuropathy completely resolved and never came back. And so we just had to break that cycle, right? We had to break that cycle where the oxidative stress wasn't being quenched.
And that's amazing. I didn't realize that that could resolve after such a long time of having it. 'Cause
Yes,
it's
it can.
yeah.
It can. I mean, what we know is given the right conditions, the body will repair itself. And so we have to have those conditions. And so you just have to understand what conditions are needed, right?
Right.
And provide this.
As you were talking, I was reminded you have an amazing resource on your website. Well, actually, 2 amazing resources. One is a supplement guide that outlines some potentially useful solutions for side effects of cancer treatment. And then you also have this great, I think you call it the care planner, the
Yes,
Outsmart care
yes.
planner. Can you tell us
So
more?
many years ago, I did a lecture for Designs for Health on how to manage the side effects of cancer and cancer treatments. And I made a cheat sheet and a handout, a summary of my lecture. And there are some things like glutamine, acetyl L-carnitine, omega-3 fatty acids, those sorts of things are on there. And then I feel very strongly that primary care and frontline clinicians really need to get comfortable working with cancer patients, but most are super uncomfortable because nobody has any training. If you didn't specialize in oncology, then you really are at a loss. And especially to understand what the cancer survivor needs. Like, who gets training in that? So that's part of the training we provide to physicians. And so one of the most important things is, as a naturopathic or functional medicine clinician or nutritionist, somebody comes in your office, they have a cancer history, they have a cancer treatment history, and you have to think about them differently. You have to take the history differently. So I created this care planner, which walks the clinician through the kind of questions you want to ask the patient and what you want to look for in their medical records so you understand why they're coming to you and saying, I'm fatigued. It's not that they're hypothyroid. It's that their bone marrow never recovered from chemo, or the chemo really damaged their mitochondrial function. So you have to think differently about these patients because patients just complain of their subjective symptoms.
Right.
And we have to be able to figure out what that root cause is. And so it's a skill to take a history of someone with cancer treatment, or some. We have large populations of patients who live with cancer as a chronic illness, right? And so these are patients who have some measure of tumor burden that they're going to live with as a chronic illness. But you think of that like diabetes or high blood pressure or high cholesterol. It's something you monitor and manage. And it's really a new way to think about long-term cancer survivors. But many of these people are undergoing toxic treatments or hormonal treatments as well. So there are side effects to those treatments. So again, if you're a clinician and someone comes in and they are a long-term cancer survivor and they're under treatment, they have unique needs. And so it's important to understand how to take their history and how to understand what their health challenges are as well. So let's say someone's on estrogen blockade therapy because they had
Mm.
estrogen-driven cancer. A lot of those patients have joint pain because there's estrogen receptors in the connective tissue. And so we've learned, for example, that high doses of vitamin D and doing more yoga and stretching is sufficient to manage that pain. And so the way to understand if a cancer patient is in an optimal range of their serum vitamin D is to measure it, because patients utilize vitamin D at different rates. And so we monitor our patients about every 3 to 6 months with blood tests to make sure we're optimizing their system.